This is Radio Health Journal. I'm Reed Pence. This week, is it constitutional to require addicted drug users to stay clean and send them to jail if they relapse?
Not only do I find that to be cruel, it's also entirely unreasonable.
Drug use and the law, when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
That's kind of the dirty little secret in giving, is that we actually receive more than the person on the other side.
The joy and business of giving to charity. Then,
public speaking, why we fear it, and how to overcome the fear. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes and Stitcher.
For the last 50 years, America's drug policy has been to get tough. Since then, medical science has pretty much proven that addiction is a disease, and jailing drug users won't cure it. But courts continue to disagree. A Massachusetts woman named Julie Eldred is one of the latest examples. She had been placed on probation, the result of stealing jewelry to support her opiate addiction.
By no means would I ever argue that she shouldn't be punished for the larceny. Absolutely, that is a crime, and she should pay her debt to not only the person she stole from, but her debt to society.
That's Eldred's attorney, Lisa Newman Polk, who doesn't quibble with her client's responsibility for the original crime. Rather, she takes issue with the conditions of Eldred's probation that, according to Newman Polk, unfairly punished her client.
The probation order, however, telling her that she must be drug-free is essentially an order to Julie that says you need to be in remission or cured of your substance use disorder, or we're going to put you in jail. And not only do I find that to be cruel, it's also entirely unreasonable. I argue that it is unconstitutional to order a person who has a substance use disorder to be drug-free and then criminally sanction that person for a relapse.
Supporters of Eldred's appeal say it had the potential to mark a landmark shift in the justice system's attitude toward addiction, that it was a perfect example of an individual with substance use disorder being punished for a symptom of her illness. But the Massachusetts Supreme Judicial Court disagreed back in July, ruling that Eldred could be required to remain drug-free and then sent to jail when she didn't, as if a substance abuser has, at the very least, a large degree of control over their disease. And it's not like Eldred wasn't trying. According to Newman Polk, her client was not only staying sober, she was also undergoing medication-assisted treatment using Suboxone, attending mental health therapy, and participating in mutual help groups such as Narcotics Anonymous. We don't expect that much from people with any other disease.
100% compliance or perfect adherence to treatment is never an expectation for other diseases. So if you have diabetes, no one expects that you're going to have perfect A1C scores for your entire life. Often there are ups and downs in people's trajectory and people's recovery.
That's Michael Botticelli. Before he was named executive director of the Grayken Center for Addiction at Boston Medical Center, Botticelli served as the director of National Drug Control Policy under President Obama. He advised the president on the nation's anti-drug efforts and aimed to reform the tough love legal approach.
This is where policy and practice for people with addiction hasn't matched up. And I think the Eldred's case is a really perfect example of that. That, here was a person who was in treatment, seemed to be making a commitment to treatment, unfortunately had a relapse with no other criminal involvement, and was sent back to jail as a result of not being perfectly compliant with treatment. And, unfortunately, he had a relapse like many other conditions. The hallmark of addiction is that people continue to use in spite of significant negative consequences. And the pathway out of addiction often takes time.
When Julie went into custody, she was immediately taken off of the Suboxone therapy that she had started for the previous week. In Massachusetts, medication therapies like Suboxone and methadone are not permitted. When she tested positive in court that day, the court, by jailing her, really interrupted her treatment process. So instead of allowing her to continue to work with her providers, the court interrupted that process by jailing her, which was counterproductive.
And it's not just that Eldred's medical and mental health treatment was being disrupted. According to Dr. Barbara Herbert, the immediate past president of the Massachusetts Society of Addiction Medicine, it's much worse than that. Putting individuals with substance use disorders in jail, she says, is like playing a game of Russian roulette.
In Massachusetts itself, the likelihood of someone being released from incarceration and dying of an overdose is 120 times the likelihood of an average person dying from an overdose. I mean, it's phenomenally problematic to tuck people away in a situation where they are forcibly detoxed and then discharged from prison. I frankly think it's not only unscientific, it's cost ineffective and immoral.
If somebody actually has been put into forced abstinence, which is to say they weren't able to get a hold of substances, even though they are rampant in a lot of facilities, if they're not able to get a hold of substances or they're using different substances or maybe not the same level, somebody goes out into the community and uses their drug at the same level they were using before they went into custody, and that can easily lead to an overdose because their body has recalibrated. Even if you get somebody in a forced abstinence, that is not treatment, because treatment is, and getting better and really having recovery is about being able to manage this mental health disorder. It's about being able to manage the cravings, managing triggers, managing all the emotions that are flooding, and especially with the criminal justice population, and I can't emphasize this enough, the people that are addicted who are ending up in our criminal justice system are, by and large, hugely traumatized individuals.
It's clear that locking up substance abusers and expecting them to recover without access to the proper resources doesn't work. And even though it appears Eldred had science, medicine, and logic on her side, the Commonwealth expressed a different opinion in court and got it to stick, denying that there was any scientific consensus on the model of addiction and arguing that comparing addiction to other brain diseases is especially problematic.
This isn't about whether addiction is a disease or not. It's about what kind of disease addiction is. And it's the kind of condition, it's the kind of clinical phenomenon, it's the kind of behavior that responds to incentives, that responds to carrots and sticks. And that differentiates it very, very profoundly from a traditional brain disease, let's say Alzheimer's.
Dr. Sally Sattel is a psychiatrist and addiction specialist. She has more than 20 years of experience working at methadone clinics, where she's constantly interacting with people with substance use disorder.
Just come to my clinic every day. We ask people, why did you decide to stop using? Why did you decide to come for help? And not everyone needs professional help. A lot of people do recover on their own, but if you ask either folks who recover on their own or those who come in for formal help, they have reasons, and those reasons are typically in the form of consequences.
Some people would say Eldred did face consequences, but Sattel says they have to be realistic.
Well, I wouldn't have handled the case the way the judge did on a clinical basis. I mean, we have diversion programs that respond in a more, I'd say a more humane way, a more incremental way, so that, for example, it's not a one strike and you're out kind of a thing.
It's still unclear the level to which a person truly has the ability to choose whether or not to use drugs and the role of negative and positive consequences. What we do know is that addiction has a profound effect on decision-making. The degree to which a person maintains their will is murky.
If they meet criteria for substance use disorder, then relapse is really not willful within the sort of criminal justice framework that we have. I don't think that it is reasonable for the court to be making a determination, well, I think this person with addiction had a willful relapse and this person with an addiction didn't have a willful relapse.
So is having the threat of jail hanging over an addict who's trying to stay clean productive?
It has been motivating to the extent that people in that situation really don't want to go to jail. right? So don't want to be incarcerated. However, my observation has been that despite this very sincere and desperate feeling of not wanting to go to jail and the fear of going to jail that a good portion of my clients experience, it's not stopping the compulsion to use. And I think that's information in of itself for us as a society, that despite this very severe negative consequence, it doesn't stop this compulsive use.
Ultimately, the court sided with the Commonwealth, ruling that the science behind addiction is yet to be resolved and passing on the opportunity to set precedent for compassionate, science-based addiction treatment, at least in Massachusetts. The criminal justice system is a powerful tool that's constantly being reformed as society progresses. There's always going to be some level of disagreement on the correct path to take, but most of us would agree that the desired outcome is healthy and meaningful lives for those with substance use disorders.
There is no doubt that the criminal justice system can be a really powerful lever and motivator for people to seek care and get involved in care. And my personal story is, I think, a perfect reflection of that. And I think this case can also be an example of that. One of the things that we have to make sure is that, we use that leverage in compassionate and humane ways. And again, that our response to things like relapse are not inconsistent with our scientific understanding of that.
Botticelli was the nation's first drug czar to personally deal with addiction, shaping his passion for addiction treatment reform. Interestingly enough, what propelled him to recovery was a run-in with law enforcement. Even though Eldred's appeal was denied, there is another battle she's facing, one that will never amount to a single win or loss, but will instead be measured by a continuous commitment to recovery, one day at a time.
One of the things that we know, that this is a chronic condition, that people aren't cured, but, in essence go into remission. And that remission, to be supported over time, usually has to be accompanied by some level of ongoing recovery support. So while we clearly know that medications and treatment play a critical role in people's ongoing recovery, that people need some level of support to maintain that recovery, often across their lifespan. That can include 12-step work, that can include a whole host of other kinds of recovery support programs. We know that those kinds of things are essential as companions to clinical treatment.
So what's the solution? In a country with such an entrenched prison industrial complex, is it even feasible to make a 180-degree turn towards a treatment model?
We've done a really great job in this country with having a jail bed on demand. We've really mastered the industrial prison complex system. And in terms of whether at this moment in time, is it reasonable to say that we can afford to send everybody to treatment, we don't have a society that's set up that way. But my advocacy is really around trying to flip our model around.
Newman Polk has seen the intersection of substance use disorders and the law from both sides, since she was an addiction therapist working with people on parole. So rather than spending huge amounts on law enforcement and prison beds, she would funnel it into prevention, education, and intervention with high-risk youths, as well as treatment beds. In short, taking a health approach. She says while the criminal justice system can incentivize someone to seek help, it won't make them any better. You can find out about all of our guests on our website, radiohealthjournal.net. Our writer-producer this week is Trevor Savagno. I'm Reed Pence.
A first-ever large-scale study of dementia rates among older lesbian, gay, and bisexual adults finds they are similar to rates in the general population, but their access to health care may be markedly less. Research reported at the 2018 Alzheimer's Association International Conference finds that high rates of depression, stroke, and heart disease in the study population may contribute to the level of dementia. Dr. Heather Snyder of the Alzheimer's Association.
The number of people living with Alzheimer's disease dementia is increasing, as is the population of LGBT older adults. Respectful and responsive healthcare outreach to LGBT communities could result in earlier diagnosis and better outcomes.
LGBT individuals access services such as healthcare less often than others and are twice as likely to age alone. Their unique challenges make access to information and resources a challenge. This underscores the Alzheimer's Association's role for the LGBT community as a place to turn for guidance and support.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.